An open line of communication is key when it comes to doctor-patient relationships, but it could also end up saving your life. We're going to talk about some things you didn't know that you need to tell your doctor. Number one, if you take effervescent antacids. So this is particularly true, let's say you're going in for a procedure. Most of the time, your doctor will say, avoid all aspirin-containing products, ibuprofen-containing products, because those can thin the blood. And of course, if you're having a procedure performed, you want things to clot properly. Effervescent antacids often contain aspirin. And so, without knowing it, you're taking aspirin. And so, you know what, you got a little upset stomach, you're thinking, I just want an antacid. Well, be very careful, because like I said, a lot of these will contain aspirin, and all you gotta do is, if you read the product label, it'll tell you if aspirin or a non-steroidal anti-inflammatory is in there, so be aware.
Bleeding is always the #1 consideration with elective surgery when you're doing a hysterectomy or DNC or whatever, anything elective. We wanna make sure that the clotting, there aren't gonna be any issues with bleeding. Typically, we give patients a list of anything that may affect their clotting time, their platelets, etc. Make sure you look at that list. Anything with containing aspirin, also some supplements, so you need to be aware of that.
True story. So when I just graduated college, I had some issues with, I brushed way too hard, okay? So my gums were receding. So they basically took a chunk of tissue from the roof of my mouth and transplanted it on my lower gum line. Well, back then we weren't all as educated as we are now. So what did I do the first thing I get home? This is a pretty big procedure.
That sounds
and
painful.
there was a lot of trouble getting everything to clot. So what do? First thing I get home is I take aspirin. So 2 a.m. in the middle of the night, I am literally drowning in my own blood in my mouth, and I had to go emergently in and get, because I didn't know. So I'm taking, before I was ever a doctor, I'm taking aspirin to dull the pain, and it was just blood everywhere in my mouth.
Oh my God.
I learned that lesson the hard way, and just gotta be very, very
careful. You bring up a great point that even with dental procedures, if you you're having work done on your teeth and gums, you don't want to be taking anything that's going to affect your clotting mechanism.
And also be honest. If by chance you take something like this and then you read on the label and you say, oh my gosh, I have surgery tomorrow, I took this. Tell your doctor, because he was able to wake up and go and get help. But if we are literally in your belly and you're bleeding from everywhere, we're like, what's going on? And it may be because you took a medication. So just tell us.
And you may be better served to put it off.
Yeah.
Yes, even though you took time off and you planned, you have somebody to help you, you're better off doing it when everything is lined up.
So what else do we tell the doc?
If you had a belly button piercing, even if you no longer wear the ring in your belly button, because it can lead to scar tissue. And anytime we are doing surgery, if we want to go in through the belly button and there's scar tissue there, it can increase the probability of damage to the underlying organs like the bowel. And it's not that we can't still do the surgery, it's not that we can't still go through the belly button, but it's nice to know beforehand so that we take the proper precautions to make sure we keep you safe and we don't damage those underlying organs.
We both work around the belly button, and you know, you talk about scar tissue, but also just the question of infection.
Yes.
Like, you're more likely to have an issue with bacteria if you've had a piercing, so something that we want to know before elective surgery. Moving on, if you're considering any type of surgery around the nose, so deviated septum, turbinates, polyps, sinus surgery, it's so important to tell your doctor if you're using nasal decongestants. So #1, nasal decongestants like this are meant for short-term use only. They are not meant to be used long-term. We know that the lining of the nose actually becomes dependent on those nose drops, almost addicted in a way. So you keep having to use more and more to keep that congestion at bay. The nose becomes addicted to it. The minute you stop, you get this big rebound phenomenon. The blood vessels engorge, you get really congested. So we want to get you off nasal drops if you are on them before surgery. I've been there more than once where people had, you know, excessive bleeding inside the nose. Because of that, make sure you tell your doctor.
So nasal saline's fine though, right?
Oh yeah, nasal saline and Steroid drops in the nose are different too, but anything that's just rinsing your nose like saline is fine. In fact, that's a better way to go than even getting on these in the first place.
It's another lesson, isn't it, that just because something is over the counter doesn't mean you can use it as much as you want. Always use things as directed. You read these things carefully. It'll say use for a limited amount of time. But most importantly, open line of communication with your doctor is so very important.